Welcome to Dance to Heal. I'm your host, Jenny C. Cohen. Join me as I share stories of how dance and movement can bring healing in a way that is safe and tailored to your life. I'm a cancer survivor, mother of two, and an award-winning performer who found that movement was vital to my recovery. I created Dance to Heal Wellness and also authored the best-selling book, Outside in Recovery, Dancing My Way Back to Myself After Breast Cancer. I will bring new techniques to help you on your dance journey and healing path. Are you ready to move? Dance to Heal starts now. Dr. Nina Ahuja's mission is to empower medical professionals with the emotional intelligence that enables them to provide excellent patient care and lead effectively while maintaining their own well-being. A respected surgeon, award-winning medical educator, best-selling author, and sought-after speaker, Dr. Ahuja is a certified emotional intelligence instructor, founder of Docs and Leadership, creator and host of her interprofessional online community for healthcare professionals called the Mindful Med Community. So without further ado, I am so excited that we have Dr. Nina Ahuja with us. Did I pronounce it right? Did I do it good?
Yes, you did. That was perfect.
Well, because it's important. Here's the thing. You are a doctor that wants to help doctors deal with the stress of being a doctor.
That's true. That's true.
And because you're human also, like the rest of us, I was raised from this background that the doctors are above humanness. You're perfection, you know everything, and that's not the reality. You're human beings who came into this wonderful mode of delivery of care because you care about people.
Absolutely. It's very, very true. We come into this work with a mission often, and we make mistakes too. We have difficult and challenging times as well. So definitely a shared experience amongst us all, whether we're doctors or not.
Yes, it's a shared human experience. Right?
Yes. Yes, it is.
Yeah,
Very much so.
So please tell us, give us a little bit of background first, Dr. Nina, of why you wanted to write about it in your book, Stress in Medicine.
Yes, well, first of all, thanks for having me at this venue to be able to talk about this. This is something that I'm really passionate about, Jenny. So thanks for the invitation. The reason I actually got into writing about this is the pandemic. It actually provided an opportunity for me to do that. During the pandemic, where I'm at, we actually had an extended period of clinical closures. It was 3 months in total. And at that time, I was involved in a national leadership role where we were really dealing with a lot of the stresses that our medical trainees were dealing with disruption in their education and rotations and curriculum and upcoming exams, the uncertainty, were the exams going to happen, were they not going to happen? That really brought me back to my time in medical school when I really struggled. I had gone from a didactic learning style to a problem-based learning style in medical school. And so for me, the transition from undergrad to medicine was a tough one, where I was always used to being top of my class. And then suddenly in medical school, I found myself spiraling in self-doubt because I was so worried I wasn't going to know enough. When the pandemic happened, we were dealing with these stresses that the trainees were facing. And I remembered the times that I had had in my own medical education. I thought, let me do something here to hopefully make this experience a little bit less stressful for the trainees. And writing for me is a hobby. It's often cathartic for me. And so I decided to put together lessons that I'd learned and stories that I'd been through and experiences that I'd had together in a book, which was then going to be hopefully used by the medical trainees and healthcare professionals in general, just to talk about the stresses, to challenge that culture of silence that we have in medicine, where we hesitate to talk about our struggles, so that when I share my stories, it's a very real representation of my experience, so that I go from my highs to my lowest lows in a very transparent fashion to make it okay to talk about the struggles that we face.
I love that. This is why we completely connected on a level. I wasn't sure why, because my book, Outside in Recovery, talks about my personal experience as a breast cancer survivor on the other
Mm.
side of it, right? I think these personal stories illuminate to other people they're not alone because they see themselves in these stories. And it's really important, like you said, to break these promises of perpetuating dirty secrets.
I know,
Right?
I know, I know. And the thing is, it's these dirty secrets that give us our biggest strengths. If you, once you process it and once you accept the fact that, okay, this was something I can learn from.
I love that. I love that. Being, I came to this country at 6 from Taiwan.
Hmm.
And so I'm first generation. Feels like I don't know what kind of generation because, you come to this country and at home I had one culture. And
Hmm.
then you go out into the wide world of the United States and there was a whole nother culture. And I had to be that bridge. And it
Yes.
was it was through me we started having difficult conversations.
Hmm.
How would you recommend, Dr. Nina, for people who, because here's the thing, even medical doctors or doctors of any kind also become patients sometimes. And so that straddling of understanding when a doctor comes into your examining room, right? How is the best way a patient or client? Patients were called clients back in my day, way, way back before my kids were born,
Yes.
25 years ago. Patients were called clients back then.
Hmm.
What's the best mindset for when I go in to see a doctor that you would suggest to ease a doctor's burden? Honestly, let's just frank talk, real talk on how, because sometimes people walk into an examining room expecting answers or an argument.
Right. I mean, I think so. It depends on what role that patient is playing, in the sense that if you're a healthcare professional seeking help from a healthcare professional, that's one mindset that we have to talk about. And then if you're not a healthcare professional seeking help from a healthcare professional, that's another mindset. So to look at the first one, a healthcare professional going to another healthcare professional, one of the challenges gets to be that aspect of feeling comfortable with vulnerability. In our professional world, we have reputations. We don't want to appear weak. We don't want to appear vulnerable. We don't want to appear incapable. And the judgments that we hold on ourselves and the standards that we hold ourselves to can often prevent us from really being open about what we're feeling and what we're struggling with. And so I think that in that communication between physician as a patient to physician or whatever healthcare professional you are going to seek help from another healthcare professional, it's really important to give yourself permission to take the role of someone who is coming to someone else for an honest ask of support. I think that's really hard for some physicians to do. I have a chronic medical condition. I have rheumatoid arthritis. And so I've been in that space before where I've felt like, should I be saying this? At the time that I was diagnosed, I was a resident. I had a lot of pains in my hands and my feet. And as a microsurgeon, that was very problematic. So there was a worry that should I be talking about how much discomfort that I'm in my hands, because I operate, I do microsurgery. This is my career that's laid before me. And what was really helpful is my physician that I was dealing with really created that space for me to say, look, Nina, I'm here to help you. You can do this. You can overcome this. We have many patients who do well once we get you on the right treatment. And so it became a very collaborative, psychologically safe space within which we could interact. And I think that as physicians and as healthcare providers, we know that the confidentiality aspect is so important. So we need to allow ourselves to really receive that and be in that space so that we can really get the help that we need. Now, from a non-healthcare professional standpoint, or position, seeking care from a healthcare professional, I think patients need to come into that space welcoming the information and experience and expertise that's being relayed to them by the healthcare professional. There are so many resources out there now, like Google, for example, Dr. Google, as some people will call it, which are really helpful to a certain point. But when it comes to accessing the care from a professional who's been doing this day in, day out for many, many years, I think there's definitely a space for engagement and conversation, but to also be willing to receive the expertise that healthcare professional is bringing to you. There have been instances, even in my case, in my clinic, where patients will come with a certain expectation in mind when it comes to their surgery.
Yeah.
And I will very clearly say that that's wonderful. You have that information and I'm happy to discuss it, but keep in mind that I've been a surgeon for 20 years. And so I'm bringing that real life experience to you that you can benefit from. So that I think it's very important to create a space for dialogue, a space for active listening, a space of psychological safety so that people feel that they can really communicate openly and that you're willing to take the time to have the discussion with the person, whether you're dealing with a healthcare provider and asking for their input, or whether I'm a healthcare provider providing patients advice. The challenge gets to be is the sheer volume of cases that we have to see. And so that's where the prioritization becomes really important in terms of, is a physician or healthcare provider willing to take that time and give that time to their patients that they deserve so that they can really relay the discussions that they need to have and the problems that they're facing and vice versa, to be able to have that open dialogue. That's a two-way constructive conversation.
I love your reminder. It's a two-way dialogue.
Mm-hmm.
Irregardless of who you are walking in asking for help from this doctor. Because a lot of times, I just had an interview with someone who's launching a business to be the intermediary to help the patients have another person in their corner, because oftentimes we go in and we're so stressed out with our preconceptions of what's going to happen. We're not 100% there. We're so worried, right?
It's true. Yes.
Right. And so here's the doctor trying to get information and they have to like pull information out of you versus you just being there ready with your questions that you want answered and being open to the answers being given to you. I think that's been really important. Dr. Nina, will you give us an idea of what are the stresses that a doctor actually goes through behind the scenes? Let's pull that curtain aside and explain to us what happens. We only see that doctor in our room for 30 minutes at most. Most times doctors are blocked like 15, 20 minutes apart. And then, the nurse is pushing them to quickly get on to the next client who's upset they've been waiting, right? Because other emergencies happen. I know there's different also specialties, different schedules, different setups. What is behind the scenes that causes the doctor stress so that we better understand? For people who don't, I've worked in a hospital. I know what stresses a doctor out.
Yes.
So the audience does not understand.
Right. I think that's a great question. There are multiple factors that contribute to the stresses for physicians. One of which primarily is we want to provide great care to people. And yet, again, as I was saying, there are so many patients to see. There's so much time pressure that you can't always spend the time that you want to spend with each patient. And so there's the challenge of making each interaction meaningful such that the person you're caring for actually is able to receive the information and the guidance that you're trying to give, and while somehow maintaining a connection in that busy pace that we're trying to maintain. So that's the first thing. The other thing too is that there are lots of things going on behind the scenes. As you said, it's being a physician is really a job of multitasking, where you're dealing with that patient interaction, then you're dealing with the logistics of the paperwork and documentation. You're dealing with patient flow in the clinic, where you hopefully have really great support to help move patients through the different rooms.
Cross your fingers.
You cross your fingers that you end up in the right room, which you do.
Well, cross your fingers you have good support staff, because a doctor cannot do it alone. There's so much behind the scenes that has to get done. Sorry.
There's so much. And then, if you're running diagnostic tests and you need to look at those results and then make sure that you've had a moment to think about what treatment plan is appropriate given all the information that you've got. And then you've got questions coming in from your staff. You've got phone calls coming in that, they need to relay answers to patients. And so your staff will talk to you and say, look, this person called. Can you advise how I should be guiding them? And then if you're on call, you're getting paged through the day so that if your emergencies are coming in, you're working on those and trying to answer those questions. And then if you're in leadership, the way I was and have been for many years in my practice, there are all the administrative issues and challenges that come up with that. And so what you see when you have your physician coming in and out of your examining room is only one aspect of a totality of tasks that we're doing through a day. It's really one of those things where you're on a wheel and it's from one thing to the other, to the other, to the other, with multiple balls in the air and really making sure that you're not dropping any.
That's, oh my gosh, yes. And let's really also be honest, right? After, I like to call it the panini because we do have such different interpretations of what actually happened, right? So I call it the panini. That's an even playing ground. There is an undeniable shortage now of doctors and medical staff, and the needs of the population has actually increased.
Yes.
Right? I mean, that's a real, that's something that no one can really argue about right now. We have a shortage of doctors, nurses, and all the other ancillary staff that's required in all of our medical facilities, correct?
Absolutely correct. It's a huge challenge in healthcare right now. Yes.
Yeah.
I think that, the pandemic really pushed that along. We've had shortage issues before, but the pandemic really has augmented that, where people were really burnt out. They saw a lot of things that were really difficult to manage and handle. And so it came to a head where it was almost like, okay, I'm done, or I want to contribute in a different way. And of course, there are also the resource challenges in terms of funding and being able to pay people what they deserve and what they should have for the work that they do. And then balancing that with being able to hire more people and provide them with benefits. And then also, just right at the root of it, do you have enough spaces in your education systems and academic centers to be even able to train the number of people that we need to be training in order to help with the human resource issue? So it's a big problem. And the thing is, too, is for those who are still in practice, it's an added burden, because as people are leaving the profession or decreasing their time in practice or whatever adjustment they're making, the people who are maintaining their practices at a full load or just even in practice, period, all of those extra volumes are falling to them. All of those extra responsibilities are falling to them. Patients are able to be seen in those situations, however, much later, because the wait times are longer. And so the complexities of the conditions that are being brought forward and they're presenting with are a whole other level, which then requires more time, more care, more resources. So it becomes a very difficult cycle to which we need to be able to provide resources, provide training, provide incentives, provide education to really encourage and inspire people to want to join the profession and stay in the profession in a way that they're not going to feel as though they're being run over by a truck every day, but in a way that actually is bringing some joy and satisfaction and connection with what they're doing.
Oh, I love that, Dr. Nina. Here's the thing. I've had nurses here also at the Dance to Heal podcast who talk about how it's important to remember when you're admitted into an inpatient setting, the nurses are not your personal care attendants. Their jobs are to help the doctors behind the scenes because of the myriad of responsibilities of keeping people alive. Let's just be real talk here about hospitals, right?
Right.
And then
Yes.
people who are demanding this or demanding that, expecting this instantaneous thing. And I've had nurses having to explain to people about all the triple checking they had to do on medications alone per floor or shift that they have, on top of, again, the shortages of people. I really want to reiterate to your audience, this episode is not to guilt you. I want to be clear. I just wanted to open up this dialogue. I'm so glad Dr. Nina is here to do this. The doctors are human too. They came into this profession because they want to help us, but they're human too, meaning if you go into a meeting angry, you're not going to get a happy doctor who wants to work with you in the middle of their crazy, full, overextended day.
Yes, I agree. And you said it exactly right. Those of us who are in the profession are caring by nature. We want to help people. And that's not to say people who aren't in the profession aren't caring. I'm not saying that, but I'm just speaking from the perspective of being a healthcare provider. We're there for good reason and with good intent. And so I do really appreciate your bringing this opportunity to increase awareness of what the experience is from the side of the healthcare provider, because it is a lot. There's a lot of pressure and the stakes are high as well. right? You're really dealing in some cases with life or death. In my case, as an eye surgeon, I'm dealing with sight. I can blind somebody if something goes horribly wrong. People can be blinded from trauma, and we're trying to repair that to help restore sight. So the stakes are very high. So that level of pressure in itself is something that we carry, on top of which now, when you add the system challenges and everything else that we face, there's more happening in the background where, we need to be mindful of that. And that's what my work is about in Docs and Leadership and in the online community. But it's really about becoming emotionally aware so that we know when we're hitting those points where we are at risk of not being able to communicate as effectively as we want with a patient because we're just feeling so overburdened. And at the same time, as we said earlier, it's a two-way street. And so that patience and empathy and understanding from the patient perspective is also really valuable. And it just makes us want to help more because that's innately what we want to do to begin with.
Yes, I love that. It's always, it goes back to that. I teach my kids this, and they're college students now, about the, you can get more flies with honey than with vinegar, right?
Yeah.
When I mean, my kids are always saying, because my children are homeschooled and they've watched me role model how to present ourselves in the outside world, because just as much as we might be quick to make a judgment, people make judgments on us very quickly.
Yes.
So I would want, if you were coming to my examination room, Dr. Nina, I would immediately want you to be like, oh my gosh, I love it when Jenny comes in, versus, oh my gosh, here's Jenny again. Right?
Right. Yeah.
I had because I do an NLP training program where one of my classmates was saying how as a nurse, she actually has a problem when a client will kind of try and bribe them with gifts before the care is given, right? So
Yes.
audience members, I want to clarify, we're not talking about that. Dr. Nina and people of this genre will treat us all equally. I'm saying, right, all you're asking for is just that we see you as another human being and just connect with you on that level first.
It's funny you say that, and I completely agree. I had one patient interaction, it's just coming to mind, where I had a gentleman, he was referred to me for poor vision. He had cataracts. And so as a cataract surgeon, I was assessing him for his surgery. And immediately when he sat down, his energy was very off and he was very rough and kind of assertive with me, or aggressive with me, borderline aggressive. And I said to him right off the top, I said, you seem as though you're very upset by this conversation, yet we haven't really spoken. I haven't really started yet. So I'm not sure where this is coming from. Can you help me understand? And it turned out that he had basically had very negative experiences in previous interactions with physicians, and he was already on guard. And he said, I'm just on guard because these experiences are always bad, and I'm ready for it. And so I said to him, I said, okay, well, I'm glad you shared that. Thank you very much. But let's just give us a chance a little bit. So just give me a chance to do what I do, and I will, if I do the same thing that you experienced poorly, well, then please tell me, because I would like to know that. And immediately the energy shifted. I think the reason I am sharing that is that even as physicians, we need to be open to the fact that patients have had experiences as well. And so while you're encouraging, and I so appreciate it, patients being open to that, I think, again, that two-way element of it becomes really important. Similarly, as a patient, recognizing that, as you said, we go through multiple things every day that just build and build and build. And so, we should be able to talk about it, or at least address it and acknowledge it at some level, forums like this, and even sometimes when you're communicating with each other. Because when you address that human element, it brings us together in a different way, and it makes that interaction more rich.
Oh, I love that. So folks that are listening and watching this interview on YouTube, you can find Dr. Nina at docsandleadership.com. DOCSINLEADERSHIP.com. This is really important because I want you to always have this in your back pocket. You may have friends and family who are doctors who are stressed out beyond belief, and Dr. Nina is the person to go to. You may yourself be a doctor listening to this podcast because you were enticed by the title of this podcast that we came up with, right? feel free to look up Dr. Nina because her membership is live now. It's a month-to-month basis. You're not committed to anything, or you could get that 2 months free if you do the year long. Correct, Dr. Nina?
Yes, that's correct.
Yeah, do it. Do it. You always want to be in community. That's what I'm finding.
Yeah, and I've run pilot programs before, and that's one of the main elements that people find really valuable is that sense of community because you recognize that you're not alone. And also remember that when you deal with stress, that permeates into everything you do. And as physicians and healthcare providers, we are leaders. And so that also affects your leadership style, whether it's how you're leading patients to better health or you're leading your teams, or just even how you're conducting yourself at home as a parent or as a, an elder member of the household.
Yes.
You're a leader in sorts. And so I think that there's value in this sort of community and being able to talk about things in a very real way so that you can better your experience and the experience of those people around you in a very positive way.
I love the reminder that doctors, inherent in that definition is that you were leaders, right? And leadership is
Yes.
lonely, folks.
Mhm.
Leadership is very lonely. There's an awful lot of responsibility on your shoulders. So I really do urge you, become a part of a membership like Dr. Nina's because this is my favorite story. You ready? I'm going to talk about cabbages, Dr. Nina.
I love it.
Okay, so
I want to hear it.
cabbage story. So my family we're all farmers from the island of Taiwan. Okay. So my
Mhm.
mom comes in the middle, Taiwan's shaped like a bean. And for my non-YouTube people, I'm making a bean shape with my hand. So the middle of the bean is where my mother came from, and she can be traced across the Taiwan Straits to a little region in China called the Hakka County. My father, from the most southern tip of Taiwan, his lineage from China can't be remembered back. So he's almost regards himself as fully Taiwanese. Either way, they both came from very, very rural farming. I did
Mm.
not inherit that because I came to the States when I was 6. I cannot grow anything. Everything dies in my house. But I love this cabbage story. So, cabbages, when you plant them in the ground, thinking, oh, if I plant them further apart, they'll have more room to grow.
Mm.
They actually grow smaller and tighter.
Oh, interesting.
Yes, if you plant cabbages closer together, the
Mhm.
proximity, they get bigger and open more,
I love that. That is a
right?
great analogy. I love that.
So all my docs who are listening this, or if you know another doc, get them to join Dr. Nina's community at docsandleadership.com so you can become a full open cabbage and community versus a tight little onion cabbage. Does that make sense? I hope that's
That totally makes sense. And I love that because really what's happening in this community is that we're talking about issues. We're challenging that culture of silence. And it's not just about the stressors we face. It's about leadership development. It's about making positive work environments, positive learning environments, maintaining well-being and balance. It's really drawing it all together. And when the community, people are developing amazing relationships, friendships that'll last a lifetime. And I love what you said, because in that close proximity, people really bloom in a sense, right? The cabbage doesn't bloom per se, but it grows, as you're saying, to a bigger, more robust cabbage compared to not.
well,
I
because
love
you know
that.
the analogy about being the Shrek's onion from the Shrek shows, talking about I'm an onion of. I'm like that never resonated with me because
Yeah.
one, I like eating onions because when we peel, okay, so you peel the layers of an onion in real life, right? We open our layers.
Yes.
There's still integral parts of us. We're unable to cut those parts away. Really,
Mhm.
truly, we cannot. They're still part of who we are. They've made us who we are, our life experiences. So, audience, I think
Really.
Dr. Nina, I'm sorry. I'm just gonna preemptively ask you to come back because I feel as if this is a conversations we've only just begun.
I would love to come back. Absolutely.
Yay!
I'm here. I would love it. Thank you, Jenny.
Wonderful, wonderful. So, if you are feeling that you're stuck in your life, please go to my gift at danceandheal.com. If you need that as a precursor to beginning the work that we're talking about, you want to find a community so you can bloom instead of being tight in isolation. Dr. Nina, thank you so much for coming.
Thank you very much, Jenny, for having me. It's been a real pleasure talking to you and seeing you again as well.
Yes. Yes, we know each other from a mastermind, y'all.
Yes, we do.
We're growing in cabbage land together somewhere else.
That's right. And we're moving.
We're blooming. All right, audience. Thanks so much. We'll see you next time. Bye. Thanks for listening to Dance to Heal with Jenny C. Cohen. Come back next time to hear stories of recovery through movement and learn more ways that you can move your body. To work with me and continue your journey, visit OutsideInRecovery.com. Are you ready to move?